to get into some of those reasons why women may have incontinence, and starting with, this one's very familiar to me, pregnancy and childbirth.
So typically, a vaginal childbirth puts you at risk for damage to the connective tissues around the urethra and the pelvic floor. But changes in your hormones associated with pregnancies also affect the integrity of the fascia and the connective layers. So even if you deliver with a C-section, there's some compromise to that area. But without a doubt, a vaginal delivery has the biggest risk.
Menopause.
So the hormones change as women go through menopause, and those affect the contractility and the layers of tissue around the urethra, so because of a lack of the estrogens.
Okay, and we move on that list. We mentioned aging, but I want to reaffirm again something that you've mentioned several times is this is not having to do with aging. This could happen to anyone, correct?
It can happen at different ages,
right,
but age is certainly a risk factor.
Okay. Now, UTIs as well, we discussed, and stool buildup.
That's right. Constipation is a very big problem for the pelvic floor, and particularly for urinary incontinence, and we overlook it because most or many people have had issues with constipation their whole life. That's normal for them, but it's not normal for your bladder.
Okay. Now, can you cure incontinence? I think that's what everybody would like to know.
That's the big question.
Yes.
And there are patients that come to me and we work on behavioral modifications and their exercises, and they can resolve their issues. So I do see people that are cured of their incontinence.